Hello everyone and welcome back to my channel. My name is Tony Africa and I am doing this video to alert a lot of my fellow expats who might be coming from the UK or the United States like myself, who come to the continent, East Africa, Kenya, to be prepared in case of any emergency, especially a medical emergency. But before I begin, I would first of all like to thank all of my subscribers who wish me a healthy and a speedy recovery. I truly appreciate it. It's been a challenge for me. And for those of you who don't know, a couple of months ago in December, I had a mild heart attack in Nairobi, Kenya. And I found myself, I had to drive myself to the nearest, not the nearest hospital, because it took me 30 minutes to get there, but I had to drive myself to the hospital, to the ER, and I went to Aga Khan University Hospital, which is one of the best hospitals in Africa, not just East Africa, but I found out Africa. And based on the services and the treatment I received, I have to agree 100%. And I've been through military hospitals in the States, I've been to hospitals in the UK, and some of the best private hospitals for cardiac issues at the Cleveland Medical Center in Ohio. And I have to say, this hospital, in some cases, surpassed and surprised me. So to those who are wondering if you can have adequate medical care in Africa, the answer is yes. It's definitely yes. Okay, so but thank God, while I was there, I was treated by some well-trained national and international doctors, and it really, I'm really pleased with the treatment I received. But I have to say, I am fortunate because I had the money on my cards and in my account to pay for my treatment. If I didn't have the money, the outcome would have definitely been different. I probably wouldn't have been seen at that hospital and treated for 4 or 5 days in the ICU and afterward follow-up treatment. And that's the reason why I'm making this video, because I want to alert my fellow expats that you have to be prepared for medical emergencies. It's part of life and it can happen. Quite often when I look on YouTube and Facebook, I see the expat channels. Most people are planning what hotel they're going to stay at, what 5-star restaurant they're going to go to, what beautiful mall they're going to visit while in Kenya. But no one of these videos are ever saying, if I have an emergency, I'm going to go to this hospital, I'm going to seek out this professional. And that is key. I think about it. A lot of time you come to the continent, a lot of people take the transportation, a boda, which is a motorcycle, or a tuk-tuk. And just imagine if you're on one of these things and you fall off, or the guy swivels and you fall and break your arm and break your leg. What are you gonna do? It's not like in America or in Europe where you can just go to the local hospital and they'll treat you and they'll bill you later. It's not like that on the continent. So therefore I want people to be prepared when they come over. So there are things that you can do. You can purchase, there's different types of insurances that you can purchase prior to your trip, and so that if something should happen to you or your family, you're definitely covered. There is different types of insurance policies that will cover you. One is travel insurance. You have travel insurance, you have international health insurance, you have the local insurance, you have in Kenya they have a national insurance fund, I believe it's called, and you can participate in that as well. However, the national policy, something like Obamacare in America, is available to you as an expat, but you understand it's very inexpensive, and you might not, the services that you receive are not going to be adequate or the same as you would if you pay for private insurance. So first, let me explain to you, when you take the travel insurance, these are short-term policies designed to cover you for your trip. The travel insurances, they cover several things, like cancellations, if your bags are lost. Let me just look at my notes real quick. Okay, travel medical insurance is designed for short-term trips. It reimburses you for, in case you have to cut your trip short due to an illness or a national disaster. It covers emergency evacuation and repatriation back to your country, compensation for lost, stolen, or delayed baggage, and travel delays. If you miss your connecting flight or it's a delay in your flight, it covers that, and also covers accidental death of you or your family member. And that's the travel medical insurance. Now, a lot of companies will offer that, but you have to be very careful on what company you pick, because some people have pre-existing conditions like diabetes, heart conditions, heart arthritis, and cancer. These type of policies, if you're not careful, will exclude that. But there is some policies that you can get. Some companies offer an exclusion waiver, which you can get 14 to 21 days prior to your trip. It just requires that your premium is going to be a little higher. You have to take a physical 2 to 3 weeks prior to traveling, and have a doctor just state that you are medically stable to travel and that you're good. And if you do that, you can get a waiver, and then you'll be covered. The other type of insurance is the international health insurance policies, and that covers, it's a comprehensive policy that covers preventive checkups, chronic conditions such as hypertension, diabetes, cancer, cardiovascular, hospitalization, surgeries, prescription drugs, maternity care, newborn care, mental health services, counseling, and therapy. Additional, you can get dental and vision plans along with it. And in addition, as like travel insurance, it covers emergency evacuation if you should have to leave the country. This is a long-term policy, and usually the premium for this one is monthly. You pay this in advance, and this will cover you not just in Kenya on your trip, but if you return back to your home country, or you're traveling to another country. These long-term insurance policies, they go with you, and you can utilize them in other countries on the continent, or in other places beside the continent, in other continents as well as the African continent. Those are good policies to have if you're a frequent traveler and you're going to be traveling a lot, nomad. So as I was saying before, Kenya has a national health insurance fund. It's called an NHIF fund. It is very affordable. However, the treatment that you will receive is going to be very different than you would receive in the private hospitals or with these other policies. So, but I think it's important that expats, especially those 50 and over, if you're planning on traveling to the continent, please, after you book your Airbnb and you book your rental vehicle and all of your plans and different events that you're going to do, before you stop, make sure you book health insurance or a travel insurance policy. Don't be like myself. Don't get caught out there with an unexpected expense. Once again, thank God I had the money to pay for my hospitalization, which wound up costing me over 7,000 US. If I had a policy, it would have all been covered. In addition to that, if you are military, prior military, retired military, and you receive compensation and you receive treatment from a military hospital in America, there's also a plan for you guys as well, which you can get reimbursed for all your expenses. So I will do another video on that for our veterans who are also traveling. But until then, once again, I want to thank you guys for wishing me a healthy recovery. I thank God, I thank you guys, and I wish you all well on your journey to the continent and the world. Okay guys, thank you. And once again, if you need any information on these hospitals and different plans, you can just email me at request, REQUEST 166 at AOL.com, and I'll be more than happy to supply you with the companies and the different policies and answer your questions. Once again, this is Tony Africa, and I appreciate you guys, and I look forward to seeing you in Kenya, in Nairobi, and so you can enjoy this journey like I am. Thank you guys. Bye.